Hi friends, welcome to World Explorer. Today we are discussing about diet. Balanced diet. Balanced diet is having energy, proteins, vitamins, minerals and fats in the required quantities which are needed for our human body. So these are the foods from which we can get energy, proteins, vitamins, minerals and fats. If we need to get energy, we need to take banana, fish, sweet potato, eggs, apple, green leafy vegetables. Even there are preparations like glucose powder which is ready-made available in pharmacies. To get the proteins, we need to depend on the eggs, pulses, dry fruits, chicken, sprouts, oats and bread. If you need vitamins, we need to depend on the fish, soya milk, cereals, potatoes, leafy vegetables, mushrooms, fruits, apple, orange, mango, strawberry, dry fruits, milk, cabbage, broccoli and spinach. If you need minerals, we need to depend on curd, cheese, milk, fish, salt, legumes, soya beans, tea, iodized salt, legumes and whole grains. And if it is fat, we need to depend on the salmon, fish, tuna fish, nuts and eggs. These are the foods which are having good fats. And these are the foods, again chips, canned foods, fried foods, trans fats are the one which is causing adverse health effects to our body. It's better to avoid this type of foods. Meat products, butter, ghee, sweets, if taken in limited quantities, this is good for health, but if we are taking in excess quantities, it may lead to adverse health effects. So in the hospital we are seeing different types of diets, that is clear liquid diet, full liquid diet, soft diet and full diet. Clear liquid diet, we are giving water, lime juice, rice kanji, dal soup, vegetable soup, tea, coffee without milk. If in full diet we are giving juice, buttermilk, milk, tea, coffee, poached eggs, etc. In soft diet we are giving bread, upma, kheer, halwa, egg, fruits, desserts, sweets, and again then we are transitioning the patient to normal diet. It depends on the patient condition. So why we are modifying the diets? Sometimes if patient is having gastritis, we need to avoid the spicy foods to avoid the irritability. And even post surgery patients are having anesthetic effects, so they need to get stabilized for their digestion pattern. So we are starting with the clear liquids and then transitioning through full liquid diet and then soft diet and then full diet. And if a patient is unconscious, we are not able to give food through mouth, so we are giving liquid diet through the Ryle's tube or nasogastric tube. If there is kidney failure, we are modifying the diet and we are going to discuss this. And some persons are having tolerance to food, for example iodine allergy, they should not take the seafoods. And to treat malnutrition, we need to give high energy and high protein diet. And sometimes even the diets are being complementary to the treatment which we are giving. Next thing is renal diseases. In the renal disease, we are giving protein restricted diet, high calorie diet, full fluid control diet, sodium and potassium control diet. In the renal diseases, if a patient is undergoing hemodialysis, we are giving fluid control. That means we are asking a patient not to take more than 1 liter in a day. And protein also we are going to restrict in these patients. And sodium and potassium, again we are checking the lab values, and based on that we are going to recommend the patient how much food they can take. And if patient is having burns, they are at need of high protein diet and high caloric diet, even vitamin C, which is helpful for the healing of burns. If patient is having cancer, they are almost debilitated, so they need high caloric diet and high protein diet. If patient is having constipation, they need high fiber diet and also increase the fluid intake. If patient is having diarrhea, we need to replace the fluid, so we are giving the liquid. Not just liquid, we are giving the ORS, that is a composition of sodium, potassium, chlorine, etc. And if ORS is not available, we are making the homemade ORS. For that we are mixing a pinch of salt with a fist of sugar in water and then mixing it, and then we are giving. To add to the taste, we may add even the lemon, mint, etc. And even this is better if we are giving electrolyte replacement. Next is gastritis. For the gastritis, we are giving low fiber diet and bland diet. If patient is having hepatitis, we need to give high calorie and high protein diet. If patient is having hypertension, we need to restrict the sodium, because by taking sodium BP will increase. We need to restrict calories and also decrease the fat. If patient is having renal calculi, increase the fluid intake, calcium control diet and low oxalate diet. If patient is having obesity, calorie restricted diet and high fiber diet is needed. If patient is having anemia, iron rich diet, vitamin B12 is needed. If patient is having malnutrition or underweight, we are giving high calorie and high protein diet. If patient is having vomiting, we are replacing the fluid electrolytes, we are giving ORS. Sometimes in vomiting there is a loss of potassium, so we may advise banana, coconut water. If patient is not having any cardiac arrhythmias or cardiac conditions, we need to give very carefully when we are giving potassium rich diet. Thank you. If you like my video, subscribe, comment and like my YouTube channel and share to your friends and family members.